So what happens if you have a plastic surgery procedure and you have a complication? Well, a while back I did a carousel, and it was basically about 3 questions that you should ask your plastic surgeon. And it was definitely kind of above and beyond, at least I thought, kind of the basic of like, how many of these procedures have you done? One of the questions that I suggested that people ask is if and where you have hospital privileges. Last night, I had a patient who had a complication. It's really rare to have happen. In the last 5 years, I think I've stepped foot in an emergency room twice. However, it's surgery, guys, and complications happen. Most of the time, complications are really minor, but every once in a while, you'll have a complication that needs to be addressed either in an emergency room or taking a patient back to surgery. With this particular patient, she was seen in the emergency room, not only by the emergency room physician, but also by myself. I was able to see her, I was able to assess her, and I was able to fix her problem there on the spot. Had that patient needed to go back to surgery, it would have been me who took her back to surgery. And those things are important. And what I think a lot of patients don't realize is that not everybody has hospital privileges. So it's only because I have hospital privileges that I was able to see that patient. Had I not had hospital privileges, it would not have been me who was seeing the patient. And if that patient needed to go back to surgery, it would not be me doing her surgical procedure. So why am I making this video, right? Well, the first is to just kind of underscore that even though complications are rare, complications definitely happen in surgery, and you should always be having a plan for that. The second thing to underscore is that not all people performing aesthetic procedures are able to get hospital privileges. If you are performing procedures that a hospital would deem outside the scope of your practice, outside the scope of your training, so for example, you are, a family medicine doctor and you are doing liposuction, you are not going to be able to get hospital privileges for liposuction because they do not think that your family medicine training has given you the adequate training to be performing surgical procedures. So by asking your surgeon about their hospital privileges, not only are you ensuring your backup plan should anything, God forbid, happen, but you are also doing a level of screening of the credentials of your surgeon, which is just really important. So as always, I hope you guys found this valuable. If you guys have any questions or comments, definitely leave them below. I will do my best to answer them. And if you guys have anything else that you guys want to learn about, let me know.